Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas. Sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you to grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's edition of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet, broadcasting from New South Wales in Australia, as you know. And today I'm joined on the other side of the world, well, in the Southern Hemisphere anyway, Dr. Luis Francisco Acero Penagos. And he's in Santiago, Chile. And he is a specialist endodontist, and he is half my age, which is quite surprising because I thought to be a specialist you had to be old, but he is very young. And Dr. Acero, I will call him Dr. Acero, I'll call him Francisco. He's got four names, but I'll call him one or the other. Dr. Acero, welcome to the Ultimate Dental Podcast. Thank you for joining me.
Thank you, David, for having me here. For me, it's a pleasure sharing this time with you, and I hope to help you in this podcast that I like so much. So thank you for your invitation.
No, that's great. It's great to have you. And you came across my radar on LinkedIn, and we approached you. Michael Lamb and I approached you about working with us on the Advance My CE platform because we were looking for educators from all around the world. And of course, somebody from South America. You have a dental degree from Colombia, and then you moved to Santiago, Chile, where you became an endodontist. So, tell me about that journey. Born in Colombia, grew up in Colombia, went to university in Colombia, and then decided to move to Chile to be a dentist, and then from there become an endodontist. So let's talk about that whole transition through education.
Yeah, well, actually, I was born in Bogota, which is the capital of Colombia, and because of some things happened when I was at the high school, I had a dental alveolar trauma, and that was the first step in which I got involved in endodontics. Because of that episode of my life, I start to think in studying endodontic. I mean, dentistry and endodontics, and I studied at Universidad El Bosque, which is a good university from Bogota. And I remember actually that I felt like I liked so much endodontics even before starting my classes. But when I was about to perform my first root canal treatment, I was so scared. I didn't know what I was doing with the patient, and I said, "Oh my goodness, what did I do?" Because it was so hard. Actually, in my first experience, it was so hard. But fortunately, I had the amazing group of professors. I remember Dr. Carmen Sanchez and Dr. Luz Dari Galindo. They helped me so much in this journey, and I started to learn step by step how to perform a root canal treatment. I started to feel this love for this specialization, and fortunately, I had the opportunity to make I had a kind of scholarship or yeah, I had the opportunity to study in Chile before finishing my studies in Colombia. So it was a kind of what is the name of that word? Like scholarship? No, internship.
Scholarship will do.
Yeah, I had the opportunity to study in Chile, and I met some great people here. They were involved in endodontics as well, and I loved this country when I came here. I love this country, and I said I would like to study here. I would like to maybe m- make a career here. So that was the main thing, or the main, yeah, that was because I started to think in living in Chile, and I don't regret. It's been a long way, but I am so fortunate and I'm grateful because I took that risk when I was a young boy. I just finished my dental school and I moved quickly to Chile. I didn't work in Colombia, but here I started to work uh, as general dentist, but also I was performing some root canal treatments, easy cases. Maybe I was, making it making more complicated cases sometimes. And fortunately, I had the opportunity to study my residency here, which was a good time at the Universidad, National University Andrés Bello, that is the name in English. Is a really good university here too, and I had the opportunity to share time with excellent professionals, specialists. I remember with I appreciate like my professor, my Dr. Macarena Vega. She taught me a lot of things, many little tricks, and she is like my mentor in endodontics in Andrés Bello University. So yeah, it was a long way, but a really good one, and I'm so grateful because of that.
So, what's a week look like for you now? How much time do you spend in your own practice? How much time do you spend at the university lecturing? Um, what about even on a monthly basis? I understand you're traveling, you're lecturing, you're a KOL for Coltine, I think. Talk us
Continental.
through, yeah, talk us through your life as a specialist endodontist now, educating dental students, educating dentists, and also treating your own patients. Tell me about that.
Well, actually, yeah, when you say that, it sounds like I have a crazy life, but actually, it is a kind of crazy life because when you're teaching or when you're preparing your classes or something that you never, you're not, you never feel good with your presentations or with your cases or what you're about to say or something, because always you feel like you need to put more, you need to talk about this, or sometimes the time is shorter than you would like, you know. But I prepare my classes with I'm so dedicated. So I prepare carefully my classes um, at night after working, because I work from Monday to Saturday as an endodontist. In the middle, when I have conferences or when I have to travel, I cancel my schedule. I mean, I don't work those days. I have to travel. I make my courses, but always I have to improve my conferences or my lectures. So it's something that you never feel good with them, even if you're putting a lot of things or a lot of information or something. It's something that you never finish. And if I have some time off or something like that, I have in my mind, oh, I have to put this in my presentation or something. So yeah, I like the clinical part too. I love to be a clinician. I don't want to lose that part, at least in this part of my life. So I work hard, and actually in my mind always is the idea, oh, this case is going to be useful for my next presentation, or this surgery is going to help me with my next course or something. So like the clinical part complement my my life as a professor or lecturer. So it's something that you need to work with uh, to 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 be working constantly.
Yeah, well, if you don't have the clinical, you're kind of just working on memory, really, aren't you? You've got to really be hands on for some of the time,
Mhm.
so that you're up to date with the latest progressions in treatments and in equipment and materials.
Exactly.
Endodontics, as you would understand, is a lot different now from when I graduated. There was no MB2 when I graduated. Now everybody's got one.
Yeah. Yeah, and I think like because for example, most of my courses or my lectures, at the end of them, I have the opportunity to teach the practical part. So there's a hands-on after finishing my course. So I teach my students how to use the instruments, the materials, or something. So I I I I know that I have to be updated with the techniques. I have to use the materials or the instruments that I'm going to teach to my students. So yeah, I have always this part of me, like I have to try this, I have to teach this, and so I'm gonna practice with all of these things. And there, I graduated like 11 years ago or something, and I noticed the change in technologies, in techniques, in in, in materials, in all of those things that have um, improved or field, like at least the endodontics field.
Tell me about endodontics in South America. Do you feel that it's up with the endodontics that you see being performed in the United States? And I know you travel up to the United States a bit, and I always think that Australia and the United States are on par. They're equal in terms of education and advancement with materials, but sometimes I feel that maybe South America might be a little bit behind. Parts of Africa, parts of Asia might be a little bit behind in terms of the technology and the materials. What are you seeing in terms of just the difference between North America, where you travel to, and South America, where you work?
Mm, that is a good question. Actually, I think that in South America you can find a really, really good or excellent professionals. Uh, I had the, the experience in studying both in Colombia and in Chile, and I know that we learn we learn from from American techniques and materials and all of those things. And I think the professionals are really good in this part of the world, but maybe what is different is like we don't have the access of the latest technology, for example, or at least it's more complicated. For example, I'm thinking in gentle wave system, which is a really expensive machine, which is amazing. I would love to try someday. I have really good friends in United States. I could name Dr. Michael Rivera from Washington. He is really into this system, gentle wave, but this machine is over $60,000, and maybe in South America is complicated to to
Mm.
to have that money, to buy those machines. Or maybe I remember I went to Dallas this year. The first time that I went to Dallas this year, I practiced in the X Guide system, which is a machine full of sensors to perform the root canal treatment with a CBCT in the patient, and like where the pore or the file is, just because of the machine, which is amazing. But it's the same, like, but again, is 60,000, 40,000. It's difficult to have that money here, and maybe that is the difference. But in terms of quality of the professionals, of the specialists here, I could say that we are really good here.
Oh, good. So is rotary endodontics the preferred method of treating root canals now, or are we still doing hand instruments?
No, no. Obviously, we use mechanized systems here, and we, at least in Chile, like is a little bit better than Colombia, for example, because you have the possibility to work with microscopes, with loops, with mechanized systems and everything. And it's something, even though I'm teaching how to use mechanized systems in endodontics, which is my like the main topic that I'm teaching right now. Hands files is important for at least the beginning of the treatment. So hands files is difficult to remove completely from our daily practice. But yeah, we use really good technology, but United States has another level. Obviously, you can find another level in United States. I'm thinking, for example, in lasers. For example, there are lasers and amazing lasers, but the cost is over 100,000 or 90,000, which is a lot of money taken in South America, at least.
Oh, for sure, for sure. So, in your practice, you're using a microscope and loops all the time now.
Yeah, actually, it is something that it's been changing here, because when I studied endodontics, it wasn't a requirement to be part of the residency, and now some of universities want you to use at least loops, right? But since I got my first pair of loops, I can't work without loops, and I have a loops, ergo loops, so I don't have to bend my neck or something. I'm just working with my face, Uh, I don't have to bend my neck, so I love that system. And I use microscope, especially in the most difficult cases, or when I have to do some special things like removing instruments, um, separated instruments, for example, or when I have to localize or to find like very narrow canals or something like that. But yeah, I can't work without loops or microscope now.
No, I think that's the case even just in general dentistry. Once you start with loops, you just can't work without them. It's the difference is black and white in terms of what you see and what you miss without the loops. Exactly. Yeah. Tell me about and it wasn't on my list of questions, but tell me about separation and instrument fracture. Is that still uh, something that you see a lot of? Like, of course, they refer to a specialist to get the broken piece out.
Look, yeah, actually, that is a topic in endodontics because it is still, I mean, it is a serious thing because it could happen in every moment. Actually, you can have your instrument, a brand new instrument or something, the first use, and it could, you know, get separated, or it could be fractured just because of the complexity of the root canal treatment. In my personal experience, since I'm using Coltin endo instruments, I've noticed how this risk is decreasing because Coltin endo instruments are, I could say, because of my experience, they are better than others and they have more resistance in that aspect. So, but also it could happen, right? Uh, the thing is, like, you need to know how to solve that problem. You need to know where is the instrument fractured, what is the risks, what is the pros and cons to remove it, because sometimes you just have to left it behind and make it part of the obturation because it could be better than try to remove it. But yeah, actually, it's something that I always say. Sometimes as an endodontist, you know when it's going to happen. You like, but you have faith. Like, I know it's going to
Yes.
happen. This instrument is maybe this guy is complicated, but it happens and you feel like a cold around your
Mm.
body and everything.
Yeah, no, it's no fun, and I remember, in my career from 1982 to 2014, making that decision that every endodontic treatment I did was a new set of instruments, hand instruments, right from the start. I never did rotary. I stopped doing molars because I didn't enjoy them, um, and so I just did premolars and anterior teeth. But everybody got a new set. But even then, I still remember one fractured, a brand new one fractured. Like, you're kidding me, like.
It's not funny actually. No, and when I studied when I was studying at the dental school, I learned how to use like manual instruments, the rotatory or the mechanized systems is taught in the residency during the residency. When you wanna be a endodontist, that's when you start to learn how to make or how to use rotatory instruments. But yeah, I have had some hands files fractured or separated, and it's not funny. Actually,
It's
it's
no.
easier to remove the rotatory or the mechanized systems than a hand file.
Oh, is it?
Yeah, yeah.
Mm.
That's it. At least by passing or remove it is easier than a hand file.
All right. Let's move on to something more pleasant. Tell me about you touched on the use of lasers in endodontics. Tell me more about lasers, and tell me about some of the other exciting advancements in endodontics that you've seen over the last few years.
Excuse me, can you repeat it?
Oh, so tell me about lasers and how lasers are now used in endodontics, and then
Well,
also tell me about some of the other exciting uh, treatment advancements that you've seen, new things in treating teeth in endodontics that you've seen recently.
Bueno, lasers. Actually, I have a really good friend here, Francisco, Dr. Francisco Rubio. He's from Concepcion, Chile, and he's working with lasers, and he's doing courses, classes, and everything here and outside. And he knows a lot about lasers. The only thing that I could say is that there's a new whole world with lasers and with the new techniques, because lasers not just help us to decrease the bacterial level inside of the root canal treatment, the root canal or the canal, but also they have the opportunity to make osteotomy, to make to a flap, for example. You can make a flap or design a flap with the laser. You could even make the apicectomy with the laser, make a kind of activation with lasers. There's a lot of possibilities with these new systems. And one of my favorite, like the new system, is, as I tell you before, the gentle wave system that I would like to try. And actually, I had the opportunity to visit the University of Texas in Houston, and they have a really good background in investigation about gentle wave, and it's something that we need to continue like studying and everything, but it is promising. But
Oh,
lasers
good.
has an infinity of options or possibilities in the future. So that is the future in endodontics, I think, in the and the future of dentistry, I could say.
What's the life expectancy of a root canal filled tooth? An endodontically treated tooth. Is it getting longer? Because I know that down here in Australia, you know as implants became more popular, endodontics became less popular as well. The root canal will fail eventually, and then you'll have to have an implant. So why not just have the tooth extracted and have the implant straight away?
Yeah.
Um, that was what the implanting dentists were saying. Is endodontics treatment getting better that people can now expect to keep their root filled teeth longer?
Yeah, actually, that is a interesting question because when one of my best friends is implantologist, and we have this kind of battle about which treatment is better and everything. But I have to say that root canal treatment is a secure treatment. Is something that uh, you can say it has a very good long-term prognosis. Um, and yeah, I know that implants have been, you know, becoming more popular, but root canal, the root is better than an implant because at least the root has the ligament, for example, and it resists more the occlusal forces. Um, it's always better having your own teeth instead of a metallic part inside of your jaw or maxilla or something. But I'm not. I don't say that implants uh, are bad are a bad option or something. Actually, it's a really good option, but for me as a specialist in endodontist, implants is the last option. I mean, it's the last option when you can't save teeth because you can make a root canal treatment, then a root treatment, then a apical surgery, and there's a little steps first before the implant. And to answer your questions, the prognosis is really good, at least within the first 3 or 4 years. With a primary root canal treatment, we have about within 89 or 95% of success in root canal treatments. And retreatments is slightly lower, around um, 80, 85 or something like that. But periapical surgery has within 90 to 95%. So it is a really good option to think about instead of the implants.
Well, the difficulty I've always thought with an implant is that once it's in, it's it's very difficult to remove it, and it leaves a big hole.
Exactly.
Uh, so, and who knows yet whether um, the technology of implanting tooth buds into your jaw and growing your own teeth back.
Exactly.
Acero, I remember a patient of mine who was a researcher in tissue regeneration,
Ah,
and he
I
was
know what you're talking
working on sheep. And he said to me that, and he's my age, he said, within our lifetime, David, he said, we will be regrowing body parts. So that was 25 years ago that he said that to me. And so there's still probably another 15 years of average life expectancy for me and him to get to 80. So we've got
about.
15 years.
And
Who
again,
knows?
the best option is having your own body parts, right? And
Yes.
that is a good option. Actually, the Andres Bello, no, the El Bosque University in Bogota, they were studying a lot about that topic. And actually, those cells are they get that cells from the pulp, the 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 cells that can become to natural teeth came from the pulp. So that is a good option. And you have to keep in mind that implants can fail too, and, and some patients can reject the implants.
Oh,
So,
sure.
so
Well, no,
in dentistry, I think, or at least my point of view is like you need to try some steps first. First, root canal treatment, retreatment, surgery. Maybe if there's nothing to do, implants is a really good option. Actually, I'm not saying that it is a bad option, but I prefer to have my own body parts.
well, certainly, if you think of the advancements in eyes, you know, in when I got married, nobody was having laser eye surgery. Laser eye surgery now, everybody gets it to, so they don't have to wear glasses. Now they have cataract surgery and correct blindness,
Yeah,
um, and, and people don't have to wear glasses. So there's a lot of surgical things going on in other parts of the body, It's will it catch up in dentistry? And I hope it does. I hope that you'll be able to just pre-order and then get your tooth buds put in and regrow a tooth. I'm sure it's going to happen.
Someday,
That
no doubt.
someday for sure.
Actually, there's
Yeah.
an interesting treatment in endodontics, which is the intentional reimplantation. For example, you
Yes.
have a tooth here with bad prognosis or something, you can extract it. And maybe if you have your wisdom tooth here, which is healthy or something, you can extract it and put it here again. And the body, I mean, our body is amazing because our body have the um, quality or have the capacity to to recognize this body part and make it part again like a normal teeth. I've One of my classes is also about it, the intentional implantation, and it's a topic that I shared in one of the congress in IFIA Congress 2 years ago, and it's a treatment that has to be uh, suggested to our patients, intentional implantation. So always it's better have your own body parts, and if the the technology allow us allows us to create teeth from some cells. Yeah, it's going to be welcome for me for I think the dental community.
Well, I hope so. People still keep eating sugar, drinking soft drink and soda, and not brushing their teeth. So we can't. Yeah, they keep buying chocolate.
Yeah.
That's the problem. How do you stay up to date with the latest research and techniques in endodontics? How do you have a set list of journals that you read every week or every month? How do you stay up to date?
Yeah, actually, I'm a kind of nerd about it because sometimes I like to go to Journal of Endodontics and read just the titles and then read I used to read the papers that I like according to the title. But also, I have to say that as an educator, it like forces me to keep upgraded, in the new techniques and everything. So while I'm preparing my courses, my classes, my lectures, I'm always researching for new information, new topics, new interesting things that I read. But mostly, I'm a kind of nerd because, yeah, I go to journalofendodontics.com. I read the latest papers, and when there's a title which I like, I read it.
Do do you hang around with a lot of endodontists? Do you have social gatherings, barbecues and dinners with endodontists, or how do you how do you how do you stay up in terms of the local community of endodontics in both in Santiago, but also South America, and then in the United States as well? What's your travel and face to face communication with these people?
Well, actually, it is funny because at least here in Chile, I'm an endodontist here, but my best friend Francisco Huerta, he is prosthodontics, and actually here you used to have more communication with the prosthodontics than with other endodontics, right? Because you're like working hand to hand with this uh, like specialization with this part of the dentistry, which is rehabilitation, because the root canal treatment that I performed is going to uh, make the crown or something like that. So my my best friends are prosthodontics, orthodontics, and orthodontics. Actually, I have two really good orthodontist friends. But outside of my working environment, I have to say that endodontics have different points of view about treatments, about for example, minimal invasive endodontics or something. So I think here, at least in Chile, I have more communication with other specialties than my own specialty. Even though I'm a professor here and I used to teach in different universities um, about endodontics, obviously. But yeah, it is funny that my best friend is a prosthodontics because I perform the root canal treatment and he has to perform the crown or the
Well,
bridge.
well, that leads me to my next question, which is, how what is the role of this interdisciplinary collaboration, between, a root canal on its a root filled tooth on its own with just a filling on top is not going to survive compared to a tooth that has full coverage over it. That's always been the case. The the endodontist wants to see his work preserved and restored properly so that it lasts a long time, because uh, you know nothing upsets a patient spending all this money on a root canal and then they haven't been told by their general dentist to get full coverage, to get a crown or an onlay, and the thing fractures, and so they blame the endodontist. It's not the endodontist; it's the dentist who hasn't recommended the roof on the house, the hat on the head. That's what really what it is. So, tell me about the role of other disciplines. The prosthodontist and the orthodontist as well. Again, we've got to make sure that a root filled tooth is not overloaded in occlusion uh, or in the old days, yeah, a root canal filled tooth as a denture abutment, it also was going to be, its days were going to be numbered, weren't they?
Yeah, exactly. I mean, as you said, like I could perform a really good root canal treatment, but the restoration is everything, right? Before, so it's something that I always say in my classes or my courses, that your best friend has to be a prosthodontist because he's going to recover or to to perform a correct restoration to that tooth in order to keep it as long as you can, right? Because sometimes I don't know, for example, premolars, you can't perform just I don't know, a composite resin because you need to make a cusp. You need to cover, right, the cusps, for example, in order to help the teeth to last as long as you can, right? But sometimes just a restoration or composite resin is not going to be enough, and maybe you will have some tooth fractures or something like that.
Tell
So
me,
mhm.
how do you assess new materials that come, both and equipment, but new materials particularly in terms of what you use to do your endodontic treatment, but also restorative materials, uh, and I guess at your young age, you know, you haven't grown up with the gold crown as the best ever, which it probably was, and then of course then people said, "Oh,
Actually it's the
pin
best.
amalgams," and then and now we've got all these different types of porcelains. But I do like the fact that you logically, you know, it's very hard to think that plastic can replace enamel in terms of being strong enough to protect a tooth. And without the blood supply that a tooth has, which it loses when it has endodontic treatment, it needs that blood supply to renew the calcium in the tooth. So you're recommending still, full coverage of cusps with crowns and porcelain onlays.
Yeah, actually, to be honest, for example, at least in premolars, you need a full coverage at least because those teeth are like the risk of fracture in those teeth are higher than, for example, a molar. So you need to cover the cusps at least in those teeth. Maybe you can be, it could be different in molars because they have more stability or dimensional stability. But again, I prefer like a full coverage or at least like a onlay restoration instead of a composite resin. I like to be minimal invasive cavities to get access to the root canals. but also I prefer like the I mean the final restoration has to be performed by prosthodontics. Actually, it's a personal preference because they understand a little bit better the function and the forces involved in the biting and and all of those things. I think they understand better. But sometimes in cases in which you don't have to perform a huge or a big opening because the decay is not that deep, or you can access easily to the the root canals. Um, it doesn't. It is not that necessary. But personally, I prefer prosthodontics to perform the restoration after the root canal treatments because they understand better the function.
Yeah,
Mhm.
that's for sure. Tell me, what what's the most rewarding part that you find about being an international educator and an international speaker and an international KOL now for Colteen as well? What are you enjoying in terms of spreading the word?
Wow, actually, that is a really good question. I have to say that it was one of my dreams uh, before moving before moving here in Chile. I wanted to became I wanted to be a speaker, international speaker actually. But I at that time, I'm talking about 12 years ago or 13 years ago, I was like just dreaming because I say now it is difficult and everything. But I realized that. Um, when you have a purpose or something, you can do it. If you work hard, you can do it. And my favorite part is like uh endodontics, or at least dentistry, uh, could be different in different countries, but mostly is the same procedure. Like you need to make this step first, this step second, and you have some steps that you need to follow. And oh, I'm sorry, I got lost. What was the question? What?
No, I said what are some of the things that you enjoy about the being in an international presenter and speaker and key opinion leader? And I can tell in the first half of this answer that how much this has been something, as you said, as a goal for you. And also, I'll throw it in now that having seen you present on video as well, you're a very entertaining and engaging speaker, and
Thank you.
which is pretty difficult to do with endodontics. Like endodontics is. It's a very narrow field of dentistry. Like on just on the weekend, I was at a function and they said, "What do I do?" And I said, "Well, I was a dentist and I coached dentists." And they asked the next person what they did. They could have been an axe murderer. They were more interesting than talking to a dentist. So when somebody's talking to an endodontist,
Yeah.
like you said, it's a bit nerdy. So the question was, how do you how do you find it being now out in the limelight? And then I'll come back on top of that, if I may, and just say, how do you balance your nerdiness for education
Uh-huh.
with a balance of you know non-dental activity as well? You get that work-life balance. So let's finish off talking about the 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 travel and presenting part, but then let's come back to the bit about you know when I hang up my drill on Saturday and I've got Sunday. I don't want to hear you say that you just bury your head in journals and textbooks all day Sunday. I want to hear you say,
No.
yeah, I like to get on my motorbike, or I like to go play some golf, or go skiing, or water
Yeah.
skiing, or
Well, I like skiing,
oh, you
but
do?
yeah, I like snowboarding actually. I love that activity so much. But I love what I do. That I think that is something very important for everyone. You need to love what you're doing. If you don't, you need to search the way to love what you're doing because In that way, you're gonna have a happier life or something like that. And for me, inspiration is so important because, as you said, the endodontist is not the best or maybe the favorite field in dentistry. Actually, it's something like black and white. You can hate it or you can love it, right? Maybe there are some people in the middle, but mostly they hate endodontics because it's something that you can see. The patient is not going to notice, maybe. Um, is different than when you perform some veneers or something. The patient is, oh my goodness, you're the best doctor, you know. But actually, what I love is to inspire people, to inspire to help the people to, I mean, my patients, but inspire the students, because it is so good. The sensation you have when you help a patient with a lot of pain, with a lot of with a huge infection or something, and they look at your eyes and say, "Doctor, thank you. I've been awake 3 days because of this dental pain, and you helped me, and I'm so grateful." Or something that is something that fill my heart, and also as an educator, I think it's something that I love because I've heard some comments from my students that they had a different perspective or thoughts about endodontics, and they changed their mind because of my course, because of my classes. And it's something that make me feel good or make me sleep good at night. So that part of my job is my favorite actually.
Well, that's a really good answer because, I thank you for sharing that with me because, and with our viewers and listeners, because as a specialist endodontist, you're kind of getting people who are already prepared to save the tooth, and so the general dentist is the one who's had to deal with the people who are really terrified. The people who have gone from the general dentist to you, they're already incentivized to keep their tooth, but the result is always, and I found from my patients that I sent to the specialist endodontist were, I didn't realize how simple and easy it was going to be for them experiencing it because of the professionalism of the endodontist. But what you just said then about how you inspire your students and your dentist students, so your undergraduate as well as your graduated dentists, to embrace endodontics and and realize, um, that it is a way, as it always has been. It's the ultimate way of keeping the tooth. It was the first question I used to ask every patient that presented in pain. I'd say, "You don't want to lose this tooth, do you?" And they go, "No, I don't want to lose it." So endodontics then, the endodontics card gets dealt because they've said they don't want to lose it. So bang, if you don't want to lose it, you're going to need to have endodontic treatment. And because this is a molar, I'm going to send you to the best specialist in Sydney, and that's what I did.
Yeah,
And then he sent them back to be restored. So it was a great partnership, professional partnership between me and him. But people would say, "Oh, you're sending me right across town." I said, "Well, he's the best." And that's what I'm getting from this conversation with you, Dr. Acero, is that you are passionate about, endodontics, and you're passionate about helping people to keep their teeth as long as possible. And I think that sometimes implantologists aren't so passionate about helping people to keep their teeth. Sometimes, you know, it's it is the only alternative, but sometimes they look and they go, ah, we'll just go straight to implantology. So thank you for your passion. Um, just looking through my last sort of question, we've covered a lot in this, in this presentation. Where do you see the future of endodontics heading?
excuse me, what did you say?
Where do you see the future of endodontics going? How do you see it in the next, 5 or 10 years?
Wow, that is a really good question. Uh, okay. Since my experience, I could say that when I was studying at the dental school, there was a difference when I was studying my residency. And the main difference is the conservation of the tooth structure. right? Because like 15 years ago or something, like you needed to make a huge cavity to be sure that you're um, treating all of the root canals and all of those things. But I've noticed how that perspective um, has changed, because now there are many discussions about minimally invasive endodontics, like how to perform smaller cavities, maybe some minimally invasive treatments such gentle wave activations with laser, with ultrasonics, which is the basic thing you need to perform during a root canal treatment. But now there are a lot of technology in order to perform a root canal treatment without lose mm, uh, like this a big amount of dentin or enamel. So I think in the future we're going to be able to perform a root canal treatment with new techniques in which you don't need to perform a huge like cavities or accesses to the root canal. So I think like that is the future. Actually, I don't know. The future could be amazing in endodontics. So I think there are many options, opportunities for the future endodontics in this
So
world.
you don't see endodontics being a dinosaur treatment in the future. You see it still having a relevant role in the saving of teeth and the restoration of the dentition.
Absolutely. You can have a necrotic process without you notice. Maybe you had I mean, something hit your face 10 years ago and you didn't realize,
Mm,
and you will need a root canal treatment, and there will be
mm.
some techniques for your infection or something. But root canal treatments, in my point of view, is something necessary in dentistry, and it's something that is not going to be. Um, I mean, it's going to be relevant in the future as well as now. Obviously, with like conservative, with more conservative alternatives or treatments, but it's going to be relevant in the future for
Oh,
sure.
good. Well, Dr. Acero, anybody who wants to get in touch with you in terms of finding out more information or having you come to present at their conference or to their study club, uh, they can contact you via email and via LinkedIn. Those are the two ways that easiest way to find you.
Yeah, it is easy to find me. You can reach me on my Instagram account, which is Acero Endo. Acero is my last name, so Acero Endo. Also, I'm active in LinkedIn, so I'm always sharing some information about my courses. Uh, I'm sharing information, tips, and interesting uh, cases in endodontics in my social media. And also, I have opportunity the opportunity to be part of the Advance My C club. So I'm still working in my course, which is going to be launched soon. I hope so. So
Yes, good. Very much. All right. So we'll have those as at the end of the presentation. But for now, Francisco, Dr. Acero, it's been a pleasure having you on the Ultimate Dental Podcast. Thank you for joining us from Santiago in Chile, and we look forward to watching your career grow as a specialist endodontist. Now that I realise how young you are, you'll be doing it for quite some time. So again, thank you very much for being a part of the Ultimate Dental Podcast.
thank you so much for your invitation. It was a pleasure for me being part of this podcast. I was looking forward for this opportunity. So thank you so much, David, and thank you for your job, because I know you're working hard in Advance My C and you're working hard in Ultimate Dental Podcast. And thank you for having me here. So I appreciate it.
It's my pleasure. Thanks, Acero.
You're welcome.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favourite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.